Hi everyone, Kalei and Cheryl here, and in this module we're going to talk to you about records. Cheryl, how you doing? Favorite
Good.
subject?
Yeah, favorite subject because records are very important and we're getting ready to have our inspection. So I'll be going through them and finding all the mistakes and things we've forgotten because it's really easy to. If you don't audit your records all the time, things fall behind and you'll find out yourself. So hopefully, if you can maintain good records, you'll be in good standing with the department and you will have less deficiencies. You're
Yeah,
supposed to.
records are always changing, and if you don't stay on top of it, you will have things that will slip through the cracks.
Um,
So,
what you have to have is your written records, and you have to have them in a place and where the Department of Elder Affairs or the ACA agency staff can access them. Somebody in the facility, one person at all times, has to have access to the records so that they can give them to the department or the agency if necessary. So keep in mind if you're the owner, operator, administrator, and you go home for the night, you need to make sure that you don't leave everything locked and someone has access to those facilities records.
yeah,
One thing is your license, your facility license needs to be displayed in a conspicuous public place within the facility. When you walk into our place, we have brown cork boards, and that's where we put our license right there, and a lot of the other important things that need to be in view. You must have an up-to-date admission and discharge log. This is one of the first things that ACA will ask for when they come to inspect. They'll ask you your census, and then they will double-check it versus your admission discharge log. They'll check the name of all your residents and the date of admission, where they were admitted from, and if they have had a stage 2 pressure sore. And if you have discharged them, they will look and see the reason and the date of discharge. If you are holding a bed for a resident while they're out at rehab or in the hospital, you don't need to discharge them. You can still maintain their original record.
right.
You also, go ahead.
Oh, I was just going to say, um, sometimes we do discharge them just in case, if you don't want to take them back. Technically they wouldn't be a resident of yours. So just something to keep in mind. Sometimes I think we talk about in some of our other consulting recordings that you do need to reevaluate people whether or not you can take them back in, and sometimes that's your opportunity to make your change.
No, but maybe I don't understand what you're saying. You're only discharging when you discharge them. You're not sending them out to the hospital then writing discharge until you've made that decision, right, Kalei?
Correct.
Yeah, correct. Okay. Just clarifying.
Yeah.
You also must keep a log listing the names of any temporary emergency placement residents or any respite residents, if they're not already included on the log. You must keep up-to-date records of major incidents occurring within the last 2 years. We recommend that you keep these in a separate folder, marked, major incident reports, and not keep these in the resident folders. It makes it easier for them not to get lost. You have them there. Sometimes when you get audited, they ask for 6 months worth of major incidents. You'll be able to go through your 6 months and hand it over to them. Sometimes you just don't want to keep all the information in the resident records.
Well,
The limits what people.
this is not required to be in the resident records. This is a separate file that we keep for major incidents, and you're not obligated to have it in there. Okay? Facilities emergency management plan must be in your facility records with documentation and review and approval by the county emergency management agency. So every area has a different emergency management agency, usually by county. I know Brevard County's like that. We have our own emergency management office here. So what you'll need to do is contact them. If this is the first time you're making an emergency plan, I know we covered it in the beginning of core training, but you'll need it. They'll give you a checklist usually on what they require, and it may have random things like distance from a nuclear power plant and distance from a railroad. So you'll need to have all of those components in your emergency plan, and it needs to be renewed every year. So if there are no changes, I think you can submit that to your county. You're just going to have to find out what it is they require. So those are one of those things that you need to when you do your monthly audits and you have your checklist, one of the things in the front of your facility records will be this checklist of items that need to be renewed, and you'll see things like fire, health, emergency plan. The emergency plan may change because you depending on your county, you'll probably need a support facility agreement, which means in the event of an evacuation, which facilities will you be taking your residents to? And these support facilities are with other ALFs. You may have a friend or you may know other people, and you ask them if they'll be your support facility, and would you accept 3 people? And then you sign that support facility agreement. Now, the problem is you need to check and see if those places are still in business because sometimes they go out of business. And also sometimes one facility may open a second facility, and then when they submit their plan, they'll use both facilities as support, and they may not want to provide you support. And you need to make sure that if there was an emergency and you're evacuating people to this facility and they say, well, I can't take you because I'm taking my own residents. So you may need to update your support facility agreements, transportation support transportation agreements, and things like that. So you get those letters and you keep them in the front of your facility records file. Another thing that needs to be in your facility records is documentation that you have completed a radon testing. It's actually a requirement for opening is radon testing. So before you even open, you're going to have to you should have completed a radon test. And if you were able to open without doing a radon test, they just didn't check. So they may check at some point. Anyway, the radon tests, they sell them, I think, at Lowe's or Home Depot, and you just leave the cap open in your inside of the facility for like 24 hours, and then you cap it, and then you send it off to their lab, and they test the amount of radon, and then you just put that letter in your documentation. So radon testing, but it doesn't have to be done every year, just once. But that's one of those things that needs to be in your file. The next thing is the facility liability insurance policy. Of course, your liability policies run every year, and you'll need to get an updated certificate of insurance, and that will have to be in your file. And it's going to have to reflect the appropriate number of residents as well. So if you increase your capacity from, say, 15 to 25, I hope, you're going to have a insurance form that reflects that as well. Okay. I believe too that needs to be submitted to the state after you get it renewed. So the fire and the health, but we'll touch on that in a little bit. Cheryl?
Well, all of these are also on 58A and stuff too, and they're in ALF core training, so you don't have to remember these by heart.
That's right.
If you have a surety bond, you have to have a copy of the surety bond that's in effect. The admission package presented to your new or prospective clients doesn't have to include the contract, but you need to have those records. If you advertise that you provide Alzheimer's care, you need to have a copy of all the facility advertisements. You must also have a grievance procedure for receiving and responding to residents' complaints and recommendations. And Khaled, all these forms are found in our forms package, correct?
Yeah.
Makes it easier.
Right. Well, the advertisements part.
No, yeah, of course.
But the
you're
grievance, we have a grievance form. Our admission package is complete, so it's actually a Word doc. It's pretty easy. We just change the name.
You must have the copy of all the food service records required, which are menus, the health department inspection reports. If you have any catered food services, you need to have that contract on file. Also with the caterer's license and certificate to operate. You must have all your fire safety inspection reports issued by your local authority or by the state fire marshal that was issued in the last 2 years.
Cheryl, just to touch on the food service, the menus, again, that needs to be done every year.
Oh, yeah.
It needs to be redone, and that will be something that you need to stay on top of. You can't take it for granted that your nutritionist or dietitian is going to automatically recertify your menus. Well, the thing I don't understand about that, to be honest, is I don't understand why a menu needs to be recertified every year.
So
I mean, if
dumb.
it's good in 2014, it should be good in 2015. But your menus need to be updated, and we laminate ours and we post them on the refrigerator or someplace that people can see them as well. So,
And you definitely have to chase after your dietitian sometimes to get those updated. So don't depend on them to notify you, which, could be a problem if you go out of compliance.
let's see here. So, fire safety inspection reports issued by local authority. Same thing, they have a different time schedule than you have. So, something you have to keep in mind is that your last inspection, let's say, was August 20th, 2013, and today is August 31st, 2014. You're out of compliance. Now, the fire marshal may have you on his calendar sometime, but if you get inspected between now and then, you're going to be out of compliance. And if they come by and they find violations, even just minor things, they're not going to come back right away. So if they come out in the middle of September, they find 2 violations, they give you 30 days to go ahead and to fix these violations. So then that's pushing into October before you get your letter. So you definitely need to, stay on top of it. And if you do your monthly audits and you check these items that make up your facility records, and you just make a note. If these things are coming up, you need to reach out to these people and get these things renewed. So once again, you have 30 days after you get your fire inspection to submit that and the health inspection report to ACA. Now it would be, I think you could just fax it in to their particular department, but call the licensing office and ask them, who's the person that you need to send this to, and find out if faxing it is adequate or emailing. But you have 30 days under state law to update it. And I've done it in the past. If you don't, you will get a letter from them saying, hey, send me your updated fire inspections and health inspection reports. Okay.
Okay. You also have to keep all completed survey inspection and complaint reports and notices of sanctions and moratoriums issued within the agency within the last 5 years. I just keep those in my facility records under a separate tab under inspections, and they will check to see if they're there. Any facility record requirements for facilities holding a limited mental health license or ECC or LNS license need to be in there, those records. You have to have your elopement policy and procedures in your resident records. In your facility records. And you also have to have the resident elopement response drills documented too.
Yep, elopement drills are done 2 times a year. So be sure to, in our forms package, we have elopement policies and procedures, and we also have elopement drills. And the inspection report, another thing is your surveys. The last survey needs to be posted on the bulletin board. Be sure that you keep an updated one up there.
It's nice when they're clean.
That's
there's
right.
No deficiencies, nothing for them to read. Moving on to staff records, you need to have a copy of the original employment application with 3 references, and the verification of the freedom from communicable disease, including tuberculosis, that needs to be in their record. You need to keep all licenses or certifications for the staff providing services. That includes CNA licenses, HIV courses, medication classes, your TB test, stuff like that, CPR, first aid.
In the administrator's guide that you have as part of core training, or if you're in consulting, the administrator's guide has a pretty good checklist for staff records. Do they not, Cheryl?
They do, yes.
Which includes training and different things. Now, There's a couple of things that staff records need to be renewed every year, and one of them is verification of freedom from communicable diseases, including tuberculosis. Now, this one is going to be one that's going to be a pain to always get your staff to do, and they need advance notice to get it done, and you need to remind them a few times. So be sure that's something that they will check, and it's going to be on your little audit sheet that you're going to verify every month is that TB test and communicable disease. So Cheryl, when you send an employee to go and get this test, a new employee, do you just tell them go get a TB test done? What is it? How do you handle this?
The new employee?
Yeah.
They need to get a physical almost. I send the form that basically just states the rule of saying this employee has been examined and you found them free from communicable disease, including tuberculosis, and I have the doctor sign it. It's a form. Makes it easier.
Yeah, because they won't, if you don't do that, they're just going to come back with TB tests, but it has to say and communicable diseases and so if that letter we have that's part of our forms package it's simple. The doctor won't always sign it, but at least they know they might have to write it on the prescription or on something that says it.
Right. You also need documentation that they're in compliance with the level 2 background check. That's done through live scan vendors, and it's actually stored in an ACA record system keeping, so you can log in and print those, but you also need to print them and keep them in their staff files. You need a copy of a job description for any facility with 17 or more residents. However, I do recommend keeping that job description and having them sign it and keeping them in their folder. It kind of covers you and lets the state know that you've gone over their job description. Just if they're doing something that they're not supposed to be doing, it's a way that you can reprimand them. You can, if you get into some kind of a pickle, you can let them know, look, this is their job description, I've explained it, and they've signed off on it. It kind of covers your own.
Yeah, because they'll actually cite you and say that you need to do a better job of training and doing these different things. So if you've already got the protocols in place, you say, okay, look, they've signed off on this, but I will take further action to make sure that they understand their job better, and it is more professional, and it's to be honest, it's what an inspector sees when they visit a large community. So as close as you can get to mimicking a large community and operating in a professional manner, the more they're going to respect you and think that you're a professional. So even though you don't have to do these things, no, it's just better.
We also have documentation that the direct care staff and administrator participate in the elopement drills. Keep those in the records.
Yeah.
You're required to maintain personnel records for staff provided under a licensed staffing agency or staff employed by a business contracting. If you use a staffing agency or a third-party company to cover some of your shifts, you must have that. The contract on file.
Well, it says the facility shall not be required to maintain personal records for staff provided by a licensed staffing agency. Records. Right.
Yeah, but I put it on. Listen, you have your schedule. Your employee A calls out. Scratch the employee A's name off the schedule. I write in, Cecilia from ABC Staffing cover that shift. They leave you a receipt, proof that they were there. I staple it to the back of my schedule and I file it. That way there's no question that my staffing hours were covered. Mm-hmm. But you do have to keep a copy of the contract. You're right, Clay. I did get that wrong. Keep a contract between the facility, and the staffing agency. Keep that on file. And,
Right. I think what they you don't have to have the staffing agencies. You don't have to have that employee's TB test and all of their training documents and all of those other things. But
because they should have it.
Yeah, you do have a work schedule, and you have you have records that you had somebody covering those particular shifts. And I think that's what Cheryl means. The facility shall maintain written work schedules and staff timesheets as required for the last 6 months. So we keep your time cards and your schedules for 6 months. And if employees, if there were blanks on the schedule, they will ask about it. And that's where we take the receipts for those staffing agencies that we had. So, or just make sure there's no blanks. Okay.
Right. And you have to keep all your schedules for the last 6 months. So I keep those in our facility record binder anyways.
Right.
So,
and we have it electronic as well.
Yeah.
So as part of the forms package, we've created a schedule maker, and you're going to have all your schedules in the system as well.
Resident records. These need to be maintained on the property, in the ALF, and they must include a number of things. And these are things that you should audit too to make sure that you have everything, because ACA has a checklist, and when they audit your files, they'll go through and look for missing documents. So you must have a demographic form. The demographic form has such data on it that you require, like name, sex, race, date of birth. That's in the forms package too. You can get that. Name and address of healthcare provider, case managers, doctors, etc., etc. You have to keep a copy of the 1823 health assessment form. You have to keep any medication orders or any healthcare provider orders, nursing services, diets, DNRs, any services needs to be provided or supervised. You have to have a signed statement if they are going to refuse a therapeutic diet, so have the resident sign that statement if they want to refuse a therapeutic diet. You have to keep a weight record, which is initiated upon admission and recorded semi-annually. We do it monthly, that way you don't forget, every 6 months. Then you can monitor your residents too and make sure they're not gaining or losing too much weight. If you have unlicensed staff assisting with the medication, you need to have a copy of that written informed consent form that they've signed, and that's also in the forms package too.
Yeah, we just give it to them. Before they even move in, it's signed. So the weight record, it could change. You could also have a doctor or nurse say they want them weighed weekly, and if that's an order, then it needs to be done more frequently than that. Okay, so next is for facilities which manage a pill organizer, assist with self-administration of medications or administer medications for a resident. The required medication records must be in the file. A copy of a resident's contract with the facility, including any addendums to the contract. If you have our forms package, I sound like a broken record, but the contract's included.
Our contract is good too.
Yeah, it's pretty good. For a facility whose owner, administrator, or staff or representative thereof serves as an attorney in fact or a resident, for a resident, a copy of the monthly written statement of any transactions made on behalf of the resident. So if you're attorney in fact for the resident, you have to have a transaction log.
Right. You also need, if you're going to have a trust fund, if you're going to maintain a separate trust fund to receive funds or property belonging to a resident, a copy of that quarterly written statement of the funds or property dispersed must be in the resident records. A copy of the alternative care certification for OSS. That form needs to be in the residence records if they're an OSS recipient. And the absence of the form is not going to be considered a deficiency if the facility can demonstrate that it's made in good faith to try to get that form from DCF. You also need documentation of the appointment of a healthcare surrogate guardian or the existence of any power of attorney.
Yeah, those are important. I have a copy of the healthcare surrogate, guardian, power of attorney, DNR, living will, all of those things in the resident file. And then we also have medication files. We have It's got their MORs in there. And then in the front, we put the emergency packet to go packet. And so I always create an emergency packet, keep it in there, and I keep the hard copy of the power of attorney, healthcare surrogate, DNR, all those things. So whenever they go to the hospital and they come back, you're going to need to make new copies of that. And it's just one of those things that we do on a regular basis, is go around and make sure all the residents have an emergency to go packet in their MOR, their medication book. So that's a very important one. And it's one of those things that you need to get on admission, especially if somebody else is submitting, admitting their mom or dad or loved one to your facility. If they're not signing on their own behalf, then a healthcare surrogate documentation for whoever is signing is essential, because that's the first thing the state's going to say. If somebody else signed the contract, and they're going to say, well, do they have the authority to place them in here? Okay. For hospice patients, the interdisciplinary care plan and other documentation that the resident is a hospice patient. Cheryl, you've had experience with this one, haven't you?
My goodness gracious. And just so you know, every interdisciplinary care plan can vary from county to county and from hospice team to hospice team. We have one here in Brevard County. We have our care plan in the hospice. The ALCA surveyor she argued with me for forever, it felt, and still wrote me up that this wasn't it wasn't what it is, because she had one from a different county, and she said this is what it's supposed to look like. And
it might have been a different hospice altogether, right? It's not a state form.
No, it's the same hospice, but it just.
But it's not a state form. It's a company to company. They have their own records, and some of them are even digital, right? She even took a picture of it and sent it to you, didn't she? The surveyor
did, and said this is what it was supposed to be, and I sent it to the hospice, and they said, well, that's a different. That's Orange County, that's what they use, and we're Brevard County. So I had to argue with her and her supervisor to get the deficiency removed. But just so you know that the forms are different, but it's the information on it's pretty standard. So but those are important things to get. That's the first thing you should ask for when your patient goes on hospice.
Yeah, and they should have a copy of it in their hospice book as well. Right. So for apartments, duplexes, quadruplexes, or single-family homes that are designated for independent living, but which are licensed as assisted living facilities solely for the purposes of delivering personal services to residents in their homes, record keeping on residents who may receive meals but who do not want to receive any personal limited nursing or ECC services shall be limited to the following: a log listing the names of the residents participating in this arrangement and the resident demographic data required under this subsection. So if they're independent living and they don't receive any personal care, all you need is a log to say this room is designated as independent, and you need to have the demographic data. Okay?
Next, let's talk about the admission package. This is a pretty big package, but we offered in our forms package. It makes it a little bit easier for you.
Yeah, we have a checklist.
Yes. You need a copy of the facility resident contract, or if you have a brochure containing all the required information that meets the requirements of the facility's residency criteria. It must have the daily, weekly, or monthly charge to reside in the facility, and if you're charging for any services, supplies, and what accommodations you're going to provide for that rate. It also must include personal care services that you're going to provide, and if there's any additional cost to the resident. If you're going to have nursing services that you're going to prepare or provide to the residents, it needs to be listed, and if there's an additional cost to that. All your food service and the ability of the facility to accommodate special diets. It must have the availability of transportation, and if there's an additional cost to the resident, and any other special services that you provide, and if there's a cost to that, if any. You must also list your social and leisure activities that are offered by your facility.
Now, this is all in our contract, right?
Yes.
And just to
That's
make
why you want our contract. It's really good. It's organized.
Yeah, So, like the number one, the facilities residency criteria, I mean, that's taken right from the 58A, the daily, weekly, monthly charge to reside. So, um, all of these things should be in the contract. And a point on the transportation, um, you don't have to provide transportation. Like, it's not your obligation to provide transportation, but you are obligated to, at the very minimum, arrange transportation. So you need to make it clear, first of all, what you're going to do. Are you going to provide transportation, or you're not going to provide transportation? And if you are going to provide transportation, you sure better spell it out in great detail, what you will provide transportation for and what you will not provide transportation for, what you will arrange transportation for and what you will provide transportation for. And I'm talking like you should probably put the distance, the time of day. You should put in the frequency, right?
Definitely.
You should put in that if their care needs reach a certain level, that transportation will no longer be provided, right? I mean, if they can't really ambulate and they require lifting and things like that, are you still going to provide transportation? So you should put it in the contract that that if their care level changes, then they will no longer be able to provide transportation, but we can arrange transportation.
I have a scenario, Clay.
Mm-hmm.
Okay, you have your ALF in Jacksonville, Florida, which is in North Florida, and you put in your contract that you're going to provide transportation for your residents to all doctor's appointments free of charge. All right, here's a scenario. Resident A, who lives at your facility in Jacksonville, now has a doctor's appointment in Key West, Florida. You're
Because that's the
required,
only doctor that they
yeah,
can get in. Yeah.
you're required to drive them down there and transport them because you have that in your contract. So making sure you're very clear and limiting things, that you only take doctor's appointments up to 5-mile radius, stuff like that. Those are things you don't think of, but they will hold you to it.
Mm. And with regard to transportation, it all really depends on the type of people you bring in, and it depends on your facility. It depends on your competition. If somebody's coming by and doing a tour, and they're visiting 6 other facilities in your area, and the 5 other facilities offer transportation, no problem. I'll take you to anything you want. You need to be aware of that, because that will be, and it can be, a determining factor on whether they choose your facility or not. So you need to understand, what your competition's offering, and or be prepared to explain why they don't need transportation. Because in our facility, we bring services in to you. We have a nurse practitioner that comes. We have a podiatrist, or we bring all these activities and events into the facility, or because we charge less money, or whatever it is that we need to be prepared for. I know it's not really records, but it's just a little marketing tip there. Okay, Cheryl, next. Did you cover
The
all
admission.
the items?
Well, we're still working on the admission package.
Okay, go ahead.
But you can help me out with these. You have to include services that the facility does not provide, and if you arrange those services, include a statement of the facility's rules and regulations that you expect the people to follow, a statement of your policy regarding DNRs and advanced directives. If you have a ECC care program, you need to put in the program's residency criteria and a description of services that you will provide under that, and any additional costs or limitations. And if the facility advertises that it provides special care with Alzheimer's, you need to have a written description of those services and a copy of the residents' elopement response policies and procedures.
Right, so the copy of a facility's resident elopement response policies and procedures, it's just a notice saying this is what we do. We're required to do a elopement drill, and I'm not sure how we have it where they don't have to participate, right? It's encouraged, but the residents, it's okay.
No, I mean, unfortunately, our elopement drills have been real.
Well, yeah,
Yeah,
but
I mean,
people never left. They were always
yeah,
on
but it's just,
property.
they didn't sign out, so we ended up going into full mode and
Yeah.
instead of doing these fake ones, so.
Yeah, you'll get that family members will show up and they won't let anybody know that they're taking their mom out, and all of a sudden you're just like, "Where is so and so?" And then, you discover that the family just took them out once you call them. But I've had my heart stop a couple times.
Yeah, we've had staff looking for them, full on crisis mode.
Oh yeah, well it turned into a good drill, but those will happen. Another thing about a facility advertises that it provides special care for persons with Alzheimer's disease or related disorders. A written description of those special services. Now, if you advertise that you provide memory care or Alzheimer's services, then your staff need to have the required training. And so if you advertise memory care, that is considered Alzheimer's disease or related disorders. So if you advertise that, the state's going to want you and all your staff to have the appropriate Alzheimer's training, which is Alzheimer's level 1 within the first 3 months, Alzheimer's level 2 within the 9 months, and then every year thereafter an annual update. So, be careful what you advertise and how you do so if you're not prepared to get the training. Okay.
So before you admit someone, the resident and their responsible party, which could be their guardian or attorney in fact or their family member, have to be provided with certain documents. You need to give them a copy of the resident's contract to look over, a copy of the resident's Bill of Rights, the long-term care ombudsman brochure, which includes the telephone number and the address of the local district council. And we can go ahead and start talking about the resident contract. We have a great contract, so it's definitely important to make sure you have all the components, because this is something ACA will audit, and they look over your contract to make sure you have all the different things that are necessary.
Yeah, that's one of the things they go through. They're especially critical of doing your initial licensure as well. They want to review your contract, make sure that it states that if you are affiliated with a religious organization, if you're not, they make sure that it has a refund policy. Let's see here, I'll read through this. So it's got a list of services, supplies, accommodations to be provided by the facility, including LNS or ECC. It's got to have the daily, weekly, monthly rate, a list of any additional services and charges to be provided. It's got to have a provision giving at least 30 days written notice prior to any rate increase. Any rights, duties, or obligations of residents. I can't really think of a duty or an obligation. I'm trying to think of our contract. Do we have any? I think they have to follow the rules.
Yes.
That would be the purpose of any advance payments or deposit payments, and the refund policy for any such advance payments. So the refund policy must be in there, and you must offer a refund. So for those of you who think, well, if Mrs. Johnson moves into my facility and she passes away on the 15th that she paid for the whole month, she didn't give me 30-day notice, well, tough luck. Your contract must have a refund policy, and you have to refund for any unused days. And it's in 429. So you have to think of something else.
Okay. You also have to have a written bed hold policy and what your provisions are for terminating a bed hold agreement. I think standards like, you maybe hold it 7 days. If you're admitted to a nursing home, a healthcare facility, sometimes they're there a few months. Usually as long as the family continues to pay for the room, there's no reason not to hold it. But I personally wouldn't hold a room without payment, because get another prospective resident, because you're not really sure if that resident's going to come back or not. I know, you're really just taking a risk. But it's up to you. But you have to have a policy in place so everybody knows.
People really don't understand that when they see that in the contract. They say this bed hold policy, what does that mean? You're going to kick her out, if she's gone for more than 7 days? but it really just means that you will hold the room at the very minimum for 7 days. But I tell them if you continue to pay, most families just pay, and no problem.
Right. The resident or their family needs to notify the facility in writing of any change or status that would prevent the resident from returning to the facility. Until the written notice is received, they still need to pay the agreed upon rate. Unless the resident's medical condition prohibits them from coming back or giving you written notification. Usually that just doesn't, usually you assess the people and you know whether they can return or not. If you stay in contact with your families, you'll be on top of this.
Yeah, so emergent medical discharge, you full refund for whatever days they unused. That's just the way it is.
That's the way they tell us how to run our business.
Yeah, but just a tip on that. I don't know if we covered it in another section. A lot of communities charge a admissions fee, so that sort of makes up for it.
Offsets it.
Yeah, so you charge an admissions fee, a non-refundable admissions fee. You have to do it based on your market because some people in your community might not charge admissions fees. So you need to be aware of that. Do they charge $1,500? Do they charge $2,000? Do they charge $1,000? Whatever it is. Another thing you could consider is even if people in your community don't, in your neighborhood, in your market don't charge an admissions fee, you could also charge, an admissions fee, but you could defer it. So you say, listen, we do have an admissions fee, but we're going to defer it. So that means you're not going to have to pay anything to move in, but it will be applied to any refund that's due. And we're doing that because we know it's difficult for you to move in and come up with all this extra money, but we'll defer it, and you'll never pay more than any refund that's due. So if you move out on the 15th and we owe you $1,500 refund, we will apply the $2,000 deferred admissions fee to that refund, and you won't owe any more money. Even though there'll be a $500 deficiency, you're only owed up to the amount of the refund. So don't just let, even if you can, even $500, okay?
You're going to need it.
Try to defer it, yeah, because it hurts when you have a couple deaths and you have to give refunds, and it's not easy. Okay. Are we done with that section then?
Yeah, just more about the contract. You have to state whether you're affiliated with any religious organization. You need to let them know if you can what of the resident needs need to be, or resident needs services beyond the facility's license and capability. What you can and can't do, and you need to notify the resident in writing if they can't meet their needs anymore, and you must make arrangements for them to transfer to a care setting that has services that can help the resident system that's more appropriate. In the event a resident has no person to represent him, the facility shall refer him to a social service agency for placement, and if there's a disagreement regarding the appropriateness of placement.
Yeah, that would be considered a medical discharge. So
a lot of times hospice can help with their own hospice or home health.
Yeah. Okay, a provision that residents must be assessed upon admission and every 3 years thereafter or after a significant change. That basically means the health assessment form. So the health assessment form must be completed before admission. Upon admission, I guess you have 30 days thereafter, but don't even do that. Don't even accept people in as best you can without that health assessment form, because as soon as they're in, it's not their problem anymore. It's your problem. And you could keep going to them and saying, I need that health assessment form. I only have 30 days. I need that health assessment form. And they'll say, I know. But their mom is now your problem because they've just gone back to work and they're not going to worry about it. Or they'll book an appointment and it's 3 weeks out and you're not going to get that health assessment form in time. So you just tell them before you move in. That's just it. And it can be, how old can these health assessment form be, Cheryl?
I think it's Well, I think it was 60
60
days
days.
prior,
Yeah.
but
Yeah.
you should always check the rule because they update things and
Yeah,
change
you'll want
things.
an updated one. Yeah, things do change. So even you're hearing these recordings, some of these things do change. And then a significant change, if they go to the hospital, they need a new health assessment form. Don't let them leave the hospital without an updated 1823 signed by the doctor, right?
Correct.
And every 3 years, a new health assessment form. So your audit list in front of your resident file, one of the items on the list will be health assessment form and the last date that it was done. And when you do your audits, you see, oh, okay, look, that doesn't need to be done for another year. And if you get a new one from a hospital, when they went to the hospital and you get a new one, you put it in there and you change the date on the audit sheet. Okay? The facility's policies and procedures for self-administration, assistance with self-administration, and administration of medications. This also includes provisions regarding over-the-counter medications. Anything on that, Cheryl?
No, go ahead.
The facility's policies and procedures related to a properly executed do not resuscitate order. I think we covered this actually in the admission package. The resident or the resident's representative shall be provided with a copy of the contract. Facility may not levy an additional charge for any supplies, services, or accommodations that the facility has agreed by contract to provide as part of the standard daily, weekly, monthly rate. So don't go changing the contract after the fact.
So if you have a limited nursing services license, an LNS license, there's specific records that you need to have for that license. You need to have a record of all residents receiving the LNS services under the license type that you have and the services that you will provide. You need to keep nursing progress notes, and you need to maintain them in the resident records for every resident that receives those limited nursing services. A nursing assessment conducted at least monthly shall be maintained on each resident who receives limited nursing service records.
Yeah, and LNS licenses, for those of you who have it, you get inspected more often. So Joy, you'll be having them come in, I believe, could be every 6 months. Okay, and with regard to the type of services provided, our contracts or our admissions package has a care plan, right?
Yes.
Yeah, and that's where we list the services. Nursing assessment conducted at least monthly. You said that. Okay, Cheryl, go ahead.
No, we're on limited mental health. Let's go there.
Okay,
That's
go ahead.
you.
A facility with a limited mental health license shall maintain an up-to-date admission and discharge log containing the names and dates of admission and discharge for all mental health residents. The admission discharge log shall be sufficient provided all mental health residents are clearly identified. Staff records shall contain documentation that designated staff have completed the limited mental health training. So, got that? That's pretty straightforward.
Right. If you have a limited mental health license, you have to have some specific things in your records. So you have to have documentation provided by DCF within 30 days of their admission that the resident is a mental health resident, and documentation that the resident is receiving Social Security, Disability, or SSI income, or the OSS, and all of the following shall meet that requirement. If you have an OSS resident, you need to have that OSS form that they're receiving the SSI or SSDI due to a psychiatric disorder. And you need to have written verification provided by the Social Security Administration that the resident is receiving the SSI or SSDI for that mental health order.
Okay. ECC records, in addition to the records required under 58A -5.024 of the Florida Administrative Code, you also must maintain a service plan for each resident receiving extended congregate care services, which we talked about care plans, the nursing progress notes for residents receiving nursing services, and nursing assessments, as well as a facility's ECC's policies and procedures.
Right. Also, you have to keep good medication records. You have to keep records for any resident who uses a pill organizer. You need to keep the original labeled medication container or a medication listing with the prescription number, the name and address of the issuing pharmacy and the healthcare provider's name, the resident's name, the date dispensed, and the name and strength of the drugs, and the directions for use. Basically, you need everything for that medication, just so you know. You can't just have pill organizers sitting around with medication and not proof of what it is and what's filled in those pill boxes. You also must maintain a daily medication observation record, the MOR, for each resident who receives assistance with medication or medication administration. The MORs are really important, and I recommend auditing them daily to make sure they're up to date and they're being recorded properly.
Right. And at a later section, we're going to give you a video demonstration of our records management system that we use. It's free, and so we, like I think we mentioned, we do our own MORs. Okay. Medication records. For medications which serve as chemical restraints, the facility shall maintain a record of the prescribing physician's annual evaluation of the use of the medication. Cheryl, do you want to talk about this for a minute?
Chemical restraints. If you have a question and you can't figure out chemical restraint, just call the state and ask them. They'll be able to clarify. You probably shouldn't have chemical restraints. Some facilities do, and it's necessary. If you have unlicensed personnel, I highly doubt you'll have one, but it's just a pharmacological drug that physically limits, restricts, or deprives an individual of movement, mobility, and it's used for discipline or convenience, and not required for the treatment of medical symptom. So if you are trying to restrain them from medication for behaviors and stuff, it's as needed, and you're making the determination it's a chemical restraint. Make sure you know the difference between those and you have documentation for it.
Right, and generally speaking, I mean, things that are, it says here, and are not required for the treatment of medical symptoms. Okay, so it depends.
It's kind of like the cream, Calais, like the lotion.
Right.
That they rub on.
Right.
I forgot what it's called, but it's
so
a cocktail of
basically, if you are using chemical restraints, and that's pretty touchy. But if you are, you need to have a record of this prescribing physician's annual evaluation, and I've also heard inspectors ask for the lab results as well. So there was one ACA surveyor in particular who became a consultant, and she used to harp on that pretty heavily, that you also needed the lab results for that. And I don't know if that's something they still want, but don't be surprised if they also want to see that as well.
Right, and that's something to look for when you're doing an assessment. I remember we did an assessment on just a lady, she had Alzheimer's. We weren't really sure. And we got there, and she was just so pleasantly sitting at the table. Do you remember her, Clay? Mm-hmm. And nobody had anything to say. We kept asking people. Finally, I think we found a caregiver, and they said, well, she's really quiet and pleasant right now because they gave her the gel. So what they had is a cocktail gel they rub on her forearms when they're acting up or acting out. Basically a chemical restraint, and it sedates them because, in that state they couldn't get them to take a pill or anything. So I forgot what it's called, but look for those kind of things too, because those are things you can't do, and those are red flags.
Yep, I mean, if it's just probably not appropriate placement if they're coming into your small place, and it's just going to get you in trouble.
Right, depending on your license and
your
nursing capability and what you do, but standard license, unlicensed personnel, look for those things.
Exactly. So, records, they require constant auditing, and I'm really lucky that I have Cheryl because I'm not good at those things. Mm-hmm. So, you need to put systems in place to help you stay in compliance. And I really don't recall if we touched on another thing that comes up a lot, Cheryl, is the bed rail orders.
Oh, yes.
Yeah, I don't know why that wasn't in there, but basically...
it was biannual. or semi-annual. Now they should change it to yearly, didn't they?
No, they didn't pass
They
that.
didn't pass that.
No. So
I want to
basically, if your resident,
always
yeah, if they use bed rails,
expires.
first of all, they cannot have full bed rails. And most times when people get a hospital bed, they deliver them with full bed rails. So whenever you hear somebody saying they're getting a hospital bed, you make sure that they send them with half bed rails.
Unless they're on
And
hospice, Kelly, and they
yeah,
determine
but
they
that
need
was going to be
those.
that was going to be the exception. But hospice, then you need it documented from hospice. But the bed rails, the order must also say hospital bed with half bed rails, and it needs to be updated every 6 months. So, part of your audit record, if they have hospital beds, ACA will go around in your facility and look in the room and see if they have bed rails and make note. And they want to see the chart and they want to look and see if they have. Not only would they have to have a prescription from the doctor saying they require half bed rails
For safety.
but you also need a consent agreement from the family. So what I do as part of our admission package, we actually have a bed rail consent form that just states that if they ever need bed rails, we use half bed rails, and that you agree to allowing half bed rails. And we just get it signed right on admission whether or not they need the bed rails, and it goes in their file, and that way it's just one less thing for me to run around and get. And so what Cheryl does a lot of times is we'll just go through, do the audit, check, because somebody, things change. Somebody who didn't need bed rails now has bed rails, so we have to do a full audit. We look for bed rails specifically, and then we just send the notices out to the doctors. We have a letter, and we just say, we need to have a updated prescription for the bed rail, and we just fax them out, and we get them back and put them in the file. So there's a lot of those little things that you're going to have to stay on top of. Cheryl, anything else before we wrap it up?
No, I mean, if you stay on top of your records and always audit them, maybe get a second pair of eyes. You can also hire people to come in and do record audits. I've considered doing it, but I don't. We stay so busy. But I think if you keep your checklist that we provide in the form package, you'll keep good records and you'll get used to doing it, and things will go smoothly. Just a few things you need to always remember. Like the bed rails and different things. But definitely just audit your records and you'll be fine.
Yeah, and just a quick note, the records can be electronic as well. Mm-hmm. And so we're actually going to start switching over to, for the observation log and different things, electronic records, so it's all easily centrally stored, easy to access, and it is one of those things that it puts you on that professional level. So, not saying you have to do it, but something to keep in mind. And since just before we change off of this, we end this, Cheryl, can we just touch on medication records? For some reason we didn't, because it's not part of the 58A resident records section. Can we talk about medication records for a little bit, and what you do and how you audit them and things like that?
Yeah, sure. I think we talked about it in a different section. You just, I audit them every day. You look and make sure. We did this in another section, Clay, but let me go over it again. You audit them every day. You look for missed signatures. You find out what's going on with the resident, if they took their medication, if it was just staff overlooked something. Mm-hmm. And,
what do you do if you have a missed signature?
You get the staff to sign it if they gave the meds. So.
Right, and it's best to do it right away. And then, so you check for missed signatures, and what do you do at the end of the month when you file your MORs?
Same thing. I make sure everything's in place, all the orders are stapled, and file them away.
Right. So if there was a discontinue order for a LASIX on the 15th, there should be an order, corresponding order attached to that MOR. That's the way we do it, right?
Correct.
So it's really easy for them. They see the discontinue order on LASIX on the 13th. They flip to the back. There's the order for LASIX, and it gets filed in the residence records. So that's that. Okay? Thanks, guys, and we'll see you in the next module.